Hey Grace, I'm Meredith. I'm a student physical therapist.
Hey.
Is it okay if I treat you today?
Mm-hmm.
Okay, great. So what brings you in here today?
Well, I think I know what's wrong with me because I looked it up on WebMD. I think I have stomach cancer.
Your physician about this?
Yeah, and he told me to come to PT because I'm having back and shoulder pain, and my stomach also hurts, especially right after I eat.
Okay. Can you describe the kind of pain you feel?
Like it kind of burns and cramps, and it lasts for several minutes, and then it goes in and out in waves.
Okay. Well, I'm going to ask you a few more questions if you don't mind, and I'm going to try to get a better idea of what might be going on. So, how would you describe your overall health?
Pretty good, I guess. I don't really work out obsessively, but I wouldn't go as far to say I'm inactive.
Okay. Now, what about your cooking and drinking habits as well as caffeine?
Well, I drink 2 cups of coffee in the morning, smoke a few cigs, drink a couple Cokes, and end with a couple whiskey drinks before bed.
Oh, wow. Okay. Well, other than that, do you eat a pretty balanced diet? Involve foods from all the major food groups. Okay, so you have your whole grains, fruits, veggies, lean meats. So basically, not a lot of fatty foods, sugar, red meat, and all that. So which category would you put
I eat a
yourself
lot of fried food, a lot of red meat, white bread. I guess that's not good.
No, those foods are really acidic, and that can contribute to your stomach pain. Here, that you didn't list any prescription medications. Do you take any other over-the-counter medications that you might not have listed?
Nope.
Okay, so no, like, Advil or anything like that?
Oh yeah, I take a lot of Advil.
Okay, well, Advil falls into a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs, and these can be hard for the body to process as well, and they can also cause symptoms like you're feeling. So why do you take so much Advil?
For my stomach and my back pain and my arthritis, I started taking it because my arthritis bothered me a lot during the day, and then I started noticing the back and stomach pain later.
Okay. Also, I see that you have a family history of GI cancer. I'm sorry. Has your doctor ever talked to you about something called a peptic ulcer or stomach ulcer? Are these terms that sound familiar?
No, what does that mean?
Okay, so here, I actually have a handout that may be helpful. So this is talking about peptic ulcer disease, and the symptoms you're describing are pretty consistent with a gastric ulcer, which involves the lining of the stomach. So sometimes your body will form peptic ulcers either in the lining of the stomach, like I described, or at the beginning of the small intestine. So balance must be maintained in the upper GI tract between the mucosal insults and defenses. If the balances are interrupted, the formation of an ulcer may occur. And this is involving stomach acids produced by receptors in the body and also inhibitors of stomach acid. So there are a lot of different things going on in your body that contribute to these ulcers, but we're going to go through some other things to help me figure out exactly what's going on.
Okay, well, yikes. I think this might be my problem.
Yeah, but it's okay because we can take care of it with just a few lifestyle changes. So you said your stomach hurts severely right after you eat. Do you find any relief from taking antacids like Tums or?
No, I don't. Does that help you identify what's wrong with me?
Yes, like I said, that's also consistent with the stomach ulcer, also known as a gastric ulcer.
Are there any other causes of stomach ulcers?
Yeah, so there's this bacteria called H. pylori, and this can be tested with a few lab tests, and so the treatment will be a little different depending on the cause. So that's why I'm probably going to refer you back to your physician to get some lab work done, and then he'll decide if he thinks that you should have an endoscopy, which is just a small little surgical procedure. And so they'll put you under and then basically just put a video camera through your mouth to look into your esophagus and stomach and see if we caught the problem, hopefully before anything bad happened, like a stomach bleed.
How big of a chance do you think it is that I actually have one of these? I'm not stressed at work or anything. Life is pretty good. Stress is usually what causes stomach ulcers, right?
Well, it's funny you should ask that because that's what everyone always talks about. But actually, since treatments for H. pylori bacteria were discovered, that stress, caffeine, diet, all those things have shown to be like less of a cause of these stomach ulcers. So 90% of the cases are actually a result of NSAID, like Advil, overuse, and this bacteria. So luckily you're pretty young, and patients with stomach ulcers often don't show symptoms until complications occur, especially in older individuals because their pain receptors might not work as well as yours do. So it's actually good that you're feeling this pain, although I know it might not seem like it right now.
Thank goodness.
Yes, so like I said, I'm going to make sure you get an appointment with your primary care physician again, and then you can check back into me, and maybe you can do physical therapy for other musculoskeletal issues in the future. Do you have any other questions?
I don't think so, unless, do you think that I'll need surgery?
No, so basically after you talk to your doctor, he'll prescribe a regimen for you, which may include antibiotics, and he might put you on something called a proton pump inhibitor to reduce the amount of stomach acid because in a complicated way, it makes your body stop producing too much acid, which is what's hurting you.
Okay.
And then also, I need to talk to you about a few lifestyle changes.
Okay.
So you really, really need to quit smoking, and you need to drink more water so you can basically just to cut back on your alcohol and caffeine intake.
Okay, I really like my cigs.
Well, did you hear what I said you needed to do?
Not smoke cigarettes.
That's right. And then also, studies have shown that it's really beneficial if you get at least 3 days of moderate exercise. But you can do whatever you want. That's the great thing about it. You can walk, you can bicycle, you can swim.
Okay.
And all these things will hopefully make your symptoms go away and avoid surgery or a stomach bleed.
Awesome. So I'm going to take less Advil, drink more water, instead of all those bad things apparently that I'm eating. I'm going to try to quit smoking, and I'm going to exercise.
Yes. Okay, well, thank you so much. I think you're going to get all better.
All right. Well, thanks.